Chairman of the Presidential Task Force on COVID-19, the Secretary to Government of the Federation, will make his remarks. We'll receive the briefing from the Minister of Health, the Director General NCDC, as well as the National Coordinator of the Presidential Task Force. After which, we'll take briefings from other ministers, particularly the Minister of Foreign Affairs, the Minister of Aviation, and the Minister of Environment, in that order. Thereafter, we'll take your questions, they'll take their notes, and they'll come back to the podium with their answers. I now invite the Secretary to Government of the Federation, Mr. Boss Mustafa, to please make his remarks. SGF.
Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, I welcome you to this national briefing of the 8th April 2020. Yesterday, the national briefing shifted to Lagos and was jointly held with the Lagos State Governor and his team. The visit to Lagos by the team is informed by the fact that being the epicenter of the virus, the Presidential Task Force considered it expedient to pass information on the level of preparedness for the war against COVID-19, case management, contact tracing, the impact of the lockdown, and to compare notes on a number of policy issues. Today is the 10th day of the lockdown of Lagos and Ogun states, as well as the Federal Capital Territory and some other states across the nation. As expected, we will continue to evaluate the impact of the restriction order on the spread of the virus and level of compliance. The President will be appropriately advised within the coming days on the next step to take. Again, I feel compelled to underscore the importance of collaboration with the Presidential Task Force by Nigerians. Our compliance with the directives and orders given is in the best interest of humanity and to save lives. The Presidential Task Force was in Lagos and was very satisfied with the level of preparedness and the strategy of control. The various ministers and members will brief you on the details of the visit. I am pleased to inform you that the Presidential Task Force, working in collaboration with the Accountant General of the Federation, have concluded and published details of accounts into which donations by well-meaning members of the society and corporate organizations can be channeled. I must emphasize that transparency and accountability shall remain the hallmark of all transactions under COVID-19 activities. Ladies and gentlemen, within the coming days, Nigeria shall be receiving equipment and other technical support through the United Nations system, as well as other donors. You will be adequately briefed when such deliveries are made. Let me at this juncture emphasize the protocol of social distancing and personal hygiene. This is a war against a very potent and invisible enemy, and I admonish all citizens to please observe diligently. I also urge all state authorities not to make pronouncements or take decisions that would undermine public safety in this regard. Early this morning, I had the privilege to meet with the leadership of the Catholic Bishops' Conference of Nigeria. I am pleased to inform you that the conference has placed at the disposal of the Presidential Task Force the entire 435 hospitals and clinics nationwide for use as part of the national response infrastructure. Similarly, the conference has released its public health specialists to support the Presidential Task Force in coordinating access and utilization of the facilities when the need arises. We use this opportunity to thank the Catholic Church of Nigeria for its magnanimity and call on other faith-based bodies to join in the prosecution of this war against this pandemic. The creation of awareness and mobilization of adherents remain critical to the success of our strategy. The expansions of the infrastructure for treatment is important. However, private hospitals that have capacity to manage COVID-19 cases shall seek certification by the Committee of Infectious Disease Experts assembled by the Federal Ministry of Health for standardization and safety of frontline staff and other patients. It may interest you to know that all emergency isolation and treatment centers established by the PTF have also undergone this process in view of the danger posed by this infectious disease. I shall now invite the Honorable Minister of State Health, followed by the Director General and the National Coordinator and other ministers to update you on developments. Thank you.